Thank you very much, Dr. Romick. We are very grateful to the Pan American Health Organization, or PAHO, for hosting us here today. And we are very pleased to have Dr. Francisco Becerra with us this morning. Dr. Becerra is Assistant Director of PAHO, the Regional Office for the Americas of the World Health Organization, or WHO. Dr. Becerra.
Good morning, everyone. On behalf of Dr. Carissa Tien, our director, I give you the most warm welcome to the Health House of the Americas, the Pan American Health Organization here in Washington, D.C. As you know, and I'm sorry, but this is not the first time the Academies meet here, so it's welcome back, and I hope to see you again soon. This is, as you say, a very nice setting, and as neighbors, we can share the space with you. As you know, the level of penetration, use, and popularity of information and communication technologies among the world's population creates agile bridges of information on a diverse range of events that are of global concern or of particular interest. Information on disasters, movies, economic debacles, sporting events, political meetings, and even music and videos come from and to all possible corners in the world. There are many sources of data that contain information about the health of a community. Some of these sources, such as hospitals and clinics, provide relatively reliable inputs to existing health monitoring systems, but often give a delayed and incomplete view. More novel data, sources such as school attendance, veterinary clinics, social media, pharmaceutics, and sales and movements, and climate, do not contain as much information by themselves. But when multiple traditional and non-traditional sources, structured and unstructured, are combined together, however, they can give a more rapid, reliable, and actionable picture of the community's health than clinical data can alone. Internet and mobile cell phones provide an accessible amount of data about social behavior, including the types of searches performed on the web, the information communicated through schools, social networks, tweets, written by specific people, the types and sources of medicines bought by individuals, places an individual visits or eats at if they are absent from school or work due to illness, along with many other daily activities. If used correctly and ethically, this information could lead to early warning or alert systems in healthcare, which would enable public health sectors to track or monitor early detection of outbreaks and cases, quickly identifying foodborne illnesses, and facilitate immediate response in emergency and disaster situations by quickly locating individuals affected. All of this information is part of what is called a digital shadow, which suggests that there is currently more information available about oneself on the web than we have or create. When looking at social behavior analysis in relation to non-communicable diseases, new theories have arisen which suggest that chronic NCDs could become contagious, metaphorically speaking, through the imitation of human behavior made readily available on social networks and media. Positive habits that could be imitated include the propagation of good physical exercise practices, healthy eating habits, and dissemination of information via recommended reading lists. Negative aspects include bad habits like smoking, having a high-fat and calorie diet, not exercising, or indulging in unsafe pastimes. All the aforementioned behaviors could be imitated through virtual connections or as a result of following people of interest in the social media setting, and the same is true for communicable diseases. The investigation and control of communicable diseases will also benefit greatly from unstructured data captured by mobile devices or the clicks of social behaviors. These are very powerful tools in the early detection of geographic identification of infections. Statistics indicate that an unprecedented phenomenon in the history of information technologies is taking place. And this expansion of virtual resources represents a unique opportunity to carry out an investigation of the qualitative aspects of the movement called big data. These aspects include an exploration of the type of unstructured data and information circulated in these networks, the information most often shared regarding individuals' overall health and the benefits of using these technologies, and experienced by different social groups. A deeper understanding of these topics will help to highlight the vulnerable aspects of the population's health and also shed light on events that can be prevented, both of which would represent positive gains in public health. At PAHO, we are committed to work with key partners in the world to revolutionize public health practices in the Americas through the implementation of a big data strategy and a series of web-based tools of community health monitoring that enable the automated mining of large quantities of web content, data, text, tweets, posts, audios, videos, etc., both structured and unstructured in nature and which are generated by social behaviors. Our strategic goals are: 1, to ensure development and implementation of national e-health and big data strategies. 2, ensure open and ethical data access. 3, promote big data, health sciences, and education. 4, encourage public-private partnerships. 5, accelerate big data health practices. 6, ensure development and implementation of national digital literacy programs. For this, we will call on experts in the region to work together and achieve our stated objectives. I do wish you all a successful workshop. Thank you for being here.